Innovative Events podcast. Today I have with us Adam Courchaine from NuMed. Welcome, Adam.
Thanks for having me, Amy.
Thank you for joining us. So, we are going to be kicking off some new episodes here with Adam from NuMed Direct Primary Care, where we will talk over medical, tips and advice and learn about what Adam does. So, with that, Adam, why don't you go ahead and tell our audience who is just turning in, who may have never met you, a little
Sure.
bit about yourself and what inspired you to do healthcare?
Okay. So, boy, how far back should I go? I guess I'll just start with this that growing up, I didn't know what I wanted to do. My undergraduate was in exercise physiology. I liked that a lot. That really turned me on to the human body and how it works. And then from there, I worked for a number of years at a children's hospital in Boston, testing lungs on little kids. And then I went back to graduate school, became a PA. And that's where I really got to learn about the human body and wellness versus sickness. And truthfully, when you learn that stuff, it's really sickness. You learn a lot about that, which is appropriate and very important. But then, now I think I'm on my 19th, going on my 20th year. And I've worked in some different fields, whether it's geriatrics, pediatrics, Army military medicine, internal medicine. And then we started NuMed in 2018 because I was kind of sick of just doing the same old of waiting until things broke and then trying to fix it. So we didn't create the model of direct primary care, but direct is between me and a person, not 5 other people. So we just do the most appropriate medical care. And that allowed me to take a real good side note and focus on proactive care instead of reactive care. So I guess that's a nutshell.
All right, so perfect. So as we're thinking of anybody who's listening, who might be the right kind of people to come and see you?
That's a great question, and I should give you a very limited answer, but the truth is everybody. I really do believe that because some people say, I have nothing going on. I say, that's the perfect time to focus on 30 years down the road. That's proactive care. So we do a lot of that stuff. Some people say, well, I have this problem. No one's listening. They can't figure out what's wrong with me. We're really good at that too. We do a lot. The latest thing, not the latest, we've been doing this for about 5 years, but hormone therapies. And that's kind of a big buzz thing these days with menopause. You hear that big word, or menopause, or whatever else. And the idea of being an optimal human, how do we do that? How do we do that the best? So we're working on some different things there. I just got some advanced certifications. It's great. So I often say it's like taking off the training wheels and trying to be your healthiest self.
No, that's exciting. I think for every listener, this is going to be very refreshing because many times when we go to a doctor's office, it's how can we put a Band-Aid on this?
Yep.
So to truly get a great perspective from you, not only medically and in your experience and education of how can we be preventative, I think this is going to be a very exciting episodes to come and what we'll cover. So with this, I had another question for you.
Okay.
What is
Right.
something about you, either
Okay.
personally or professionally, that people might be surprised to learn?
It's tough to answer that because, well, I tell people, all my patients know I'm an open book. I will tell you everything. So I don't know. I can imagine our friend Dave there saying, well, not everybody knows you're in the Army, but a lot of people do. So yes, I joined at 39 to be a lieutenant at the time as a physician assistant. Clueless, didn't know what I was doing. I was one of those officers. But since then, now I'm upwards of I'm a major now. And the nice thing is that has helped me in my private practice because taking control of a situation and trying to foresee the right outcome and making it happen, yeah, that's what we do. So I don't know if that's a secret. I guess I wasn't prepared.
I mean, for many people that is, right? I have a history. We know each other. We've been working together and close friends. So
Yeah.
to me, that's, I know what you're up to, but it's some good information. Now, another good question then is, why would people want to work with you?
And yes, that is a good thing to get out there for folks. So what a lot of people say is as feedback is, my God, you seem energetic. And it's funny because sometimes I don't necessarily feel energetic because I'm a human also. I'm doing the things that I'm telling you to do. So I don't always feel like going and doing exercise, or I don't always feel like choosing the right food, but I work at it. So I'm a work in progress also. Um, a thing. I say a lot of funny things in the office. That's why I think they're funny. But I tell people I will presume that I'm a human and so are you, and that's how I'm going to treat you. And a lot of people are like, great, that's all I want. I just want someone who treats me as a person, understands what my problem is, it isn't rushing out the door. So yeah, I am a humble person, but I'm also confident. So I think that's an important thing to find someone who I tell people on day one, I'm not a god. I don't know everything. I don't know anybody who does. So if someone says they do, you probably should run. So when someone's looking at you and your, I don't even want to say healthcare, your health and wellness, you should want someone who says, huh, that's interesting. You tried something out of the box and it worked. I want to look into that. I want to find out more about that. So I tell folks I learn from studies, I learn from school, but I learn from bodies too. And what works for your body, Amy, might not work for Jennifer or Becky. So we need to try things. We need to have an open mind. And I tie this into, Western medicine. Is it awesome or is it horrible? And I tell folks, it depends on what you're doing. If you have an acute problem, like a burst ovarian cyst, it's awesome. Or if you have an appendicitis or a heart attack, it's a really good system. But if you have anything chronic, say you're sad, or you're working on diabetes or fatigue, it's a terrible system. And that's where we should probably lean back on some of these sciences that have been around for thousands of years. Do I understand acupuncture completely? Nope. I studied it. Other people know how to do it. I don't. And that's not my job. So I know some in the area. So I've had patients that go, that's just a quick example, but I've had patients that go there and they find great success of something that I couldn't fix. So again, back to being humble and acknowledging that you shouldn't have a person that helps you with whatever you're working on. You should have a team. So
Wonderful. Wonderful. Yeah, no, those resources are important. So the fact that you know someone to turn to when it may not even have the answer, that's wonderful. All right. Now, we may have some listeners here who don't know the difference between insurance and direct primary care. Can you explain those differences?
Sure. Insurance, I just realized I keep saying, I'm going to try to stop that. But insurance covers catastrophic, unplanned for things. In general, life insurance, you don't get paid for it. You have it in case you die. Home insurance, car insurance, you should have those things. They're good things, but you don't expect to get anything out of it. So I heard an insurance broker put it this way, if it's December 20th and you're like, man, my car insurance hasn't paid me anything this year. I think I'm going to go hit a tree so I can get something out of it. Like that's ridiculous. But that's how we look at healthcare. So with healthcare, there's this big push out there that what are you getting for it? You should get covered if you have a heart attack. Yes. If you have cancer, you should have health insurance. It covers that. What it doesn't do, just like my car insurance doesn't make my car faster, doesn't make my car cleaner or run better. It doesn't do that. That's not insurance. I pay for those things. So my homeowner's insurance does not pay me to get new blinds on the windows or for a new paint job. Unless you try to burn my house down, then it's catastrophic. So for the human body, for the health and wellness part, insurance doesn't make people healthy at all. Insurance should at best try to make the thing as good as it was before. That's the attempt. So if my house burns down, they don't build me a new mansion, they build the same house. If my car gets crashed into and totaled, they don't show up with a Ferrari saying, hey, you got an upgrade. No, they give me maybe the same as what I had. It's never as good. Health insurance is the same way. If I have a heart attack, maybe it keeps me alive. I'm not better than I was. I can get better. But that's insurance. Health insurance is to fix those things. Direct primary care is a model of health where it's direct. It's between me and a person. So I don't take insurance at all. I don't want to deal with it because if I do, the average medical provider to utilize insurance has to hire about 7 to 8 staff members just to process it. Now the system's getting big and fat and expensive. So instead we trim down, we streamline so we can focus on care. So today is what, Friday? If anyone's watching this after the fact, today is Friday. And I saw 4 people in the office. One was an add-on and I had 1 virtual and that's it.
Okay.
And that's great. Am I being lazy? No, I'm talking to you right now. We're doing this. I'm trying to do business development, which allows me to learn new things that I didn't know before so I can provide better care. And when a patient comes to me and says, what do you think about this medicine or that one? I say, that's a new one. I've never heard of it. Let me research it. So it's better care. It's better individualized attention. That's direct primary care.
Okay, perfect. So then now let's go back into your website. Let's go into your website.
Which needs updating. So let's do the shows right now.
So with NuMed's approach, you mentioned Medicine 1.0 on your website. Can
Yes.
you explain that to us?
Yes, I like that. And there's different versions. I didn't create the idea. I've heard healthcare 1.0, 2.0, 3.0, or medicine 1, 2, 3. The idea is there was an original version. So for medicine 1.0, that version was the original. 500 years ago, we live in a little town, Amy. You go see Dr. Smith, and that person, probably a guy, but whatever, guy or gal, and you say, hey, my leg hurts. And they go, oh, hey, Amy, how's your family? They know your family. It's very personalized. And you say, I don't really have any money. And they say, well, how many chickens do you have? You say, well, here's a chicken. It was great. It was personalized attention, but there was a downfall. And the downfall is Dr. Smith might have studied, by staring at rocks, and he says, your leg hurts. I think we need to cut it off because it's an evil spirit. That's a downfall. So the upswing was personalized. The downfall was standardization of training. So then medicine 2.0 came about last couple hundred years. And that's where it said, hey, we should have medical schools. We should have training. We should have studies to prove that something's not dangerous and is effective. So that's great. Woohoo. Now you go see Dr. Smith and he or she has been through training. And there's an assumption there that they know what the heck they're talking about. That's good. But then they come in the room like, oh, hey, Amanda. You're like, well, I'm Amy. It's like, oh, yeah, whatever. So you hear the problem. Here's your problem. Here's an algorithm. Here's your plan. Have a good day. And I'm out. So the upswing was the training and standardization, but the downfall was the personalization. They don't know you. They don't know how much stress is affecting your problem, or if you have children, or if you have a job. So that's the downfall.
Right.
So frustration is, like, a lot of people say this, oh, I go there, I get a new doc of the day. Nobody knows me. I'm just a number.
Yep, exactly.
So with all the tools we have, why can't we just do both? And that's where direct primary care, we do a slightly different version. I think we go a lot deeper. But in general, direct primary care says, how about we use standardization, we use studies, we use imaging, we use labs. Wonderful. But we also know the people. That way we know if Amy comes in, I'll say Amanda, someone else. If Amanda comes in really stressed, if she's always really stressed, okay, I could appreciate that. But if she's never been stressed for the past 10 years and today she seems off, there's something going on. I know that about her, and that allows me to be a better caregiver for her.
Nice. I love it. No, this definitely is a far more personalized plan, which I think so many of us are looking for. We go to the doctors and it's you're in, you're out, and many times we even forget, what we did the last 6 months or even a year. So
Yeah.
having someone who is intuitive and paying attention, I look forward to sharing you out here with the world.
Yeah. Well, and I'll just add one more thing, Amy, is direct primary care across the board is going to be better than any insurance-based practice. That is true. And some of them do things, some might do more of this or that. So we do a little bit of everything, which I'm proud of. But the other thing too is if you need something, you call the office, they say schedule a visit in 3 weeks, all this other stuff. Yeah, whatever. My patients can text me like, oh, hey, can I get a refill of this? Sure. Hey, can I jump on a video call with you to talk about cholesterol? Sure. Do they have to come in the office? Not for that. No. Now, the add-on today was he had some flank pain. He wasn't sure if it was inside his guts and stuff. I was like, no, I need to touch that. Get in here. Thankfully, it's just a muscle. But it should be individualized and smart care. So instead of saying, well, Amy, you have a quick question, 3 weeks down the road, we'll get you in with this other person who doesn't know you, and then you can ask it. And you're like, I don't even remember what the question was.
Right.
So, all right, sorry. I got a little crazy there.
I definitely, I utilize your care. I love it. And one of the perks for us people who are business people, when we are out and traveling and something comes up, again, it is a phone call. It is a video call away, and you are there to support. And that's huge. That's huge when we're out and about. But so let's go ahead and wrap some things up.
Sure.
Do you have any closing comments you want to share with the team listening?
I welcome people to reach out, ask questions. And the fundamental thing is if you feel like you're going through life is crazy. I know because I talk to people behind closed doors. Some people look really good doing it. They make it look easy. They look like they're okay. And a lot of times they're not. So if you find that you're kind of in this sea of things and you're like, something's off. I don't feel like we're doing the right thing. Demand answers, ask them. There's a thing called DPC Mapper. You just put in those words, DPC Mapper, Google, it'll pop up. You can find local DPCs. We're here in Colorado. We have patients out of state, but they come here for visits for medical care, and that's all good. We take good care of them.
Wonderful. All right. Thank you so much. I will reiterate that, yes, please come and join us on our future episodes. We will hold them on Fridays at 1 p.m. Mountain Standard Time. So our next one we're going to host will be on July 11th. So we'll see you after the holidays. We'll be here 1 p.m. Mountain Standard Time. And Adam, you will go over the whole person care minus the middleman. So we
Yes.
look forward to that topic.
Awesome. Thanks for having me, Amy.
All right, thank you, everybody. We'll see you soon.
See ya.